Good morning, Namaskar. This is Suraj Singh speaking from Bharat, India, regarding analysis of COVID status in our country. We cannot improve ourselves, it is proved. We have no capacity to improve. Even if we have capacity, we don't want to take that. हमारी शक्ति अगर है भी कि हम सुधरें, हम सुधर नहीं सकते, ना सुधरेंगे, क्योंकि सुधरना हमारे मान के लिए खराब है. Bharat, India, an analytical informative talk on COVID-19 plus variant strain status for January 18, 2021, reported on January 19, 2021. Government provided data based worked out spreadsheet for file screen share for national awareness for government has been sleeping, and we have to worry about this. We cannot do what we are required to do, and we do what is not very important. Vaccination is ongoing, we know, but speed is, I cannot say in beginning they will make speed, but it's too low. While countries have done crores, our country is still in lakhs. I should not criticize about vaccination currently because it's too early, but other facts we have to see. If we refer to yesterday's entry, only 791 cases of testing done. I mean to say, so many people were tested, and out of which 10,064 positive cases discovered, and they say it is 1.42%. No problem. If you are not able to test, I cannot help it. Really? I can't help it, and no one can help someone. अगर आप टेस्ट ही नहीं करना चाहते, इसको आप मजाक में लेंगे, easy going में लेंगे, I don't know what is answer to that. I really don't know what is answer to that. There has been 59% drop in cases if you count from January 1st or December 31st, which is horrible. Means test is as if it is something luxurious we don't want to do. We are a very poor country, so you can say that. And here are graphics you can see. This is daily positive cases here, and this is daily tests conducted. You can see this. You can see this curve moving in I just added this curve nimbly so that you know how it's moving. It is testing values, how many cases are testing, and these are 121 entries, and you can say, is there some uniformity you can find from this, some profile or something, or it looks as if it is done under some scheme or program or some proposal. You won't find something here. You won't find anything according to requirement. Okay, this is daily number of positive cases, but testing is like this. Every person who looks at this can say that this is something at random, means it's your mood. If you want to test. If you don't want to test, don't test. That is where, means I've taken this column here, this column, and put in graphics here. So there are two graphics in addition to this. Now we move to page 5 of this sheet, and here you can see data of yesterday that is available on website, but I just copied and pasted here. So this is a report on today, that is 19, and here is 18th January, yesterday's report. So let us say, as usual, I say Maharashtra, which is 19.93, which is in lakhs. Karnataka 9.32 lakhs, Andhra Pradesh 8.86 lakhs, Kerala 8.51 lakhs, Tamil Nadu 8.31 lakhs. And you can say, I'm sorry, it's not Tamil, West Bengal, Tamil Nadu 8.31 lakhs, Delhi 6.33 lakhs, Uttar Pradesh 5.97 lakhs, West Bengal 5.66 lakhs, Odisha 3.33 lakhs, Rajasthan 3.15 lakhs, Chhattisgarh 2.94 lakhs, Telangana 2.92 lakhs, Haryana 2.66 lakhs, Bihar 2.58 lakhs, and then Gujarat 2.56 lakhs, Madhya Pradesh 2.52 lakhs, Assam 2.17 lakhs, Punjab 1.71 lakhs, Jammu Kashmir 1.23 lakhs, Jharkhand 1.18 lakhs, Uttarakhand 94,923, Himachal Pradesh 5,697, Goa 5245, sorry, Pondicherry 3866, and Tripura 333, Manipur 2886, Chandigarh 2056, Arunachal Pradesh 168, Meghalaya 137, Nagaland 120, Ladakh 96, Sikkim 6, and Andaman and Nicobar 49, Mizoram 43, Dadra 3, and Lakshadweep 14. Now Lakshadweep also, which was till now 0, has come into picture. This means I think this was only place where there was no case, but now it is also moving in, and it is changing all percentages. You can see this 3, this is active ratio, discharge ratio, which is changing, and you can say that it is changing this data, and it is really worrisome. You can say now that all graphics it has impacted upon, and this is 4.13% active cases, that is increased, and 94.67%, that is discharge cases, and 1.2% is now. So sum of this, if I just take somewhere, I can say, let us try here, sum of this, sum of these 3 values, this is now 100%, means they discovered some error was there, so now it's 100%. You can see these 3 wells, these 3, so we should think of this now. 4.13% active cases, 1.2% deaths, and 94.67% discharge cases. 5.33% is a combination of active and deaths, and it was 2.63 yesterday, so it has increased a lot. This means they were not giving right data, and data by chance, I don't know how they have given, by mistake or by something, but we have got it, and this is projection that you can say, which is very worrisome now. You can see this projection, and this graphics has changed completely. Also this has shown up, deaths have shown up, and active cases are here. You can see that crores death and active cases. So it has changed completely, पूरी तरह से चेंज हो गया है. और ये डाटा क्रोर्स डेथ का, ये डेथ्स आपकी यहाँ इतनी हैं और क्रोर्स एक्टिव केसेस यहाँ इतने हैं. You must understand this point. This is very, very important point. So what this is, sum of FT50, I'm not, FT50, that is here. Okay, let us forget this data currently, no need of this data. Now, we have to understand what we are talking of. We are talking of analysis of this data, and it says that in this current number 1 month, it is say 1.2% death and 1.2% death and 4.13% active cases. Whereas you can say crores death, in that case, when you multiply it by 130 crores, you get 1.57 crores and 5.37 crores active cases. If you proportionally do or apply to 130 crores, this is what this data says. Now, how far it is correct, I cannot justify that. It is only proportional representation, you can say. We can take like this, proportional representation. And active cases, which we have said 4.3%, same way is 1. So we have to apply our factor of 0.25 at every 3 quarters, every quarter, 3 months. And 0.25 is here, 0.25 is here, 1.5, and all these values are raised accordingly, and accordingly deaths and active cases also raised. This is, you can say, when you consider 130 crore population of our country, and this 5.33% is now horrifying figure, and we apply it to whole population, then because 6.98 crore people are affected by this. Active cases as well as deaths, and also discharge cases, which is also 94.67%. according to yesterday's data. It's big one, it's big figure. Now, these deaths and these active crores cases, they should be summed up actually just to know facts. But I'm not summed up because I have graphics here which says here you can say this is death line, this is death here, and here is population hazard is saying, and all these are here is giving you separately here crores death, and this is active cases, and these are deaths. This is really alarming. Well, they are saying that they have done everything. Government says they have done everything which was required to be done. And there's no problem. People are given advices and people are cooperating, and all COVID-19 is under control. But my suggestion is there is nothing under control, and as far as COVID-19 spread is concerned, controls are concerned, there is no success except that they have started some immunity increasing vaccines, but not to public yet. How far these vaccines are affected, I cannot predict anything. It is issue of science and medicals. I'm not that scientist on medical. But one thing is very clear that everyone has to tolerate, has to bear vaccination cost, or you can say testing cost, or you can say all treatment costs, every cost, discharge costs, all that. They are not going to do anything on that, but credit government is expecting on that. Well, credit is not a big question. You can give to government. I don't mind that. But this text, which is very demanding here, this text says that all controls are required. As usual, every day I say, it's nothing new. I say every day, control 1, control 2, control 3, control 4. Control 1 is about testing scheme, control 2 is about treatment scheme, control 3 is discharge cases handling, and control 4 is for vaccination. कंट्रोल 1 कहता है कि हमको टेस्टिंग की स्कीम बताइए, टेस्टिंग आप कैसे कर रहे हैं, कितने में पूरी करेंगे, जो कि नहीं हो रही है. बहुत ही घटिया किस्म की टेस्टिंग, बहुत ही घटिया क्वांटिटी में हो रही है, जिसको हम कह ही नहीं सकते कुछ हो रहा है. और ट्रीटमेंट तो जब टेस्टिंग नहीं है तो ट्रीटमेंट का मतलब भी उसी हिसाब से होगा. और डिस्चार्ज केसेज जो हो चुके हैं, जो बाद में प्रॉब्लम क्रिएट करने वाले, उसके बारे में कोई नहीं जानता, कुछ नहीं हो रहा है. और ये कब तक चलेगा कोई भी नहीं कह सकता, क्योंकि उम्मीद है 2029 तक ऐसा चलना है. तो इसके बारे में आप कमेंट करने का कोई फ़ायदा रहा नहीं है, क्योंकि हम कुछ कर नहीं रहे हैं. और वैक्सीनेशन की आप बात करते हैं तो वो भी एक इश्यू बन गया है. कितने दिन में क्या है, कोई प्लान है आपके पास? कोई प्लान नहीं है. बातें हैं, बातों का क्या, बातें तो दुनिया करती है. व्यक्ति वो होता है जो इफेक्टिव बात करता है, जो रिजल्ट के साथ बात करता है. ना कोई रिजल्ट के साथ बात करने वाला है, ना कोई कहने वाला है, ना कोई समझाने वाला है कि हम क्या कर रहे हैं. इट इज़ ड्यूटी ऑफ पब्लिक, इट इज़ राइट ऑफ पब्लिक, इट्स रिस्पॉन्सिबिलिटी ऑफ पब्लिक दैट इट शुड बी नोन, it should be given complete information. Everyone must get information from government what's plan, but there is no plan because they don't believe in planning. They only believe in, okay, we have done well and that's all. And what they have done well, you know, only by testing just 18.78 crore people, they have announced that, okay, fine, it is done based on 14% or 14.5% population. I'm saying they have decided everything, and 85% are taken for granted. Okay, they are okay, fine, they are assumed to be okay, there can be no COVID on them. This is achievement of government, and it's really worrisome. It's worrisome, very worrisome. Of course, you can say here 7 lakh people were tested yesterday, more than 7 lakh, which is also shameful because it's a drop down of 59% if you start from 31st December. And then only 1 crore 5,81,000 something, they say positive cases till now. And only 10,000, they say, were detected positive yesterday. And they are happy with that. See, we are most down. But they want related to this one. We simulated. Actually, even if you accept there are 10,064 cases, in fact, this is nothing but 69,665. If you consider 10,000, okay, according to proportion. It's really worrisome. Lying has no limit, 9 crores, and this value stands. And of course, now 11-24 days are required for all tests if they want to do. And ratio of those who have been exposed or who have been declared positive to those who have been tested, number of people positive or number of people tested percentage wise for last 4 days, Yesterday it was 1.42, before that is 2.52, and then 1.94 and 1.89. So average is 1.94, and this says 2.52 crores exposures on this account if you take 130 crore population into our account. Vaccination, if you have to do successfully, even I don't know what success or how it will react, how it will result, but you have to do 1.42 crores every day, which is far away. Now we can't even imagine that. हम कल्पना भी नहीं कर सकते कि हम 1.5 करोड़ 1 करोड़ 40 लाख के आसपास रोज वैक्सीन कर पाएंगे. आज की तारीख में ऐसी कोई आशा नहीं है. आने वाले समय में हो तो उसका हम अच्छा कहना होगा, क्योंकि जो स्पीड चल रही है बहुत कम चल रही है टेस्टिंग की, और आप सबको भी अगर लगाएंगे वैक्सीनेशन तो इतना आसान तो नहीं है, लेकिन लगाएं, हमें अच्छा लगेगा. और ये रही बात आपके ग्राफिक्स की, एवरीडे जो केसेस हो रहे हैं वो ये है आपके, और ये आपका डेली टेस्ट कंडक्टेड, ये आप देख सकते हैं किस तरह से टेस्ट हो रहे हैं. और अब चलते हैं हम कमेंट्स के ऊपर. टाइटल हमने दिया है यार, यू हैव गॉट टाइटल, दिस कंट्रोल्स नो आंसर्स फ्रॉम गवर्नमेंट एंड डू नॉट बी डिसीव्ड बाय कोविड, do not be deceived by vaccines, because this is only for giving immunity, no hints for risk mitigation or marginal erosion. So do not be misled by this, because this is not treatment actually, just to augment your immunity level, and you have to pay for that, don't forget it. No plans provided by government that vaccines are free. And even if it is not free, there is no plan as such when you will be given inoculation. आपको कब इंजेक्शन लगेगा इसका भी प्लान नहीं है. और अलर्ट मैंने आपको पहले कहा, दिस अलर्ट from this COVID-19 that 102 cases before 2 days was reported in our country, and inoculation of vaccines, what is scheduled nobody knows, for 130 crore public, and 1.545 crores vaccination or inoculations are required per day to provide immunity to people of this nation in 91 days, which is, it cannot be delayed for years. We have failed in testing of population at all levels, because 86% people have not been brought to test in more than 325 days. All these citizens belong to poor and lower middle classes. Ministry publishes 85% fake results only. There is no reliability on those data which ministry publishes. How can ministry claim that COVID-19 has been brought under controls? Just testing of 14% or more, which is nowhere consistent but ridiculous statement. Whole world must laugh at our performance of testing. With current speed, it will take more than 3 years for accomplishing testing. Same may apply to inoculation of immunity providing vaccines if no schedule is prepared for implementation. And it is also alerted that Norway has reported death of 25 veterans, though now they say this is not linked to COVID-19, but it's easy to deny something, but facts remain fact. All states must be made prior to resorting to abusive and negligent acts, so that undue hardships, losses may not be allowed to all those who are prone to such bad incidents. Government claim is ridiculous, and government is claiming, I quote, Government of India is taking all necessary steps to ensure that we are prepared well to face challenge and threat posed by growing pandemic of COVID-19 coronavirus. With active support of people of this country, Bharat, India, we have been able to contain spread of virus in our country. Most important factor in preventing the spread of virus locally is to empower citizens with right information and taking precautions per advisories being issued by Ministry of Health and Family Welfare, unquote. But conclusive facts that we are understanding are: ensure safety, test self, treat self, vaccine self, isolate self, oxygen self, ventilator self, etc. Do all activities yourself on your own without depending on government. Self means patient's expenses. Patients has to make own expenses. Give government only credit of those discharged, credit of all controls. Keep ready many lakhs rupees for expenses or suffer forever, because one may also be infected with strain or virus or variant. Take your own care for post-discharge from hospital or from isolation rooms on your own expense. And there are then posts for messages. URL posts, URLs are there, 45 URLs and video URLs about 58. Now COVID-19 strain variant report update on 19th, and I'm going to Bharat public must think very seriously about how to achieve risk or loss prevention by application of required pertinent measures in relation to COVID-19 plus explosion. Because nothing is being seriously done by our nation, this is no loss prevention method. Incoming vaccines shall not impart with any recovery, treatment, solution, or regular protection, but only raise immunity levels. Building or some other article item shall always remain prone to fire, but if loss prevention methods be applied, loss to life and property can be minimized. So this also applies to COVID-19 plus. Possible magnitude of risk must be understood or evaluated by analyzing its power, and then based on analysis, practical applicable solutions must be searched and finalized prior to it's too late. COVID-19 strain variant has already spread in many countries, and we know names of that. I don't repeat names here. You know it's all every day. UKPM ignored all these advices from consultants and from experts in Brazil. This strain flew from Brazil to UK, and 20% people are infected by this, and 33% people are those who have no symptoms, but they are symptomatic and they have COVID. This is status there, and 100 people might have died, and 3 million people might have been infected by that, which may rise to 5 million also. Bharat, India has crossed the 1.057 crore cases, and also 102 cases of variant have been reported. Individuals out of 130 crores, only 18.78 crores, or only 14.446% of population tested in 325 days, and 85.554% population certainly remaining untested. No worry for even COVID-19 strain plus on government on people of this country, as mostly people of ours have become sheer careless, irresponsible, and ignorant, whereas this problem has been rising every day since March 1st, 2020. No plan is available for remaining 85.54% population who have been remaining untested, which has made it possible to fix certain required milestones and schedule out prospective time scale based plan to combat COVID-19 plus impacts. Seems that in false contemplation of vaccine provision, government has neglected necessary ground organization of initial testing to detect patients and provide them with mandated treatment. Must to have a concrete schedule or plan to control COVID-19 plus just to avoid its powerful explosion, and that could cost crores lives directly and many crores additionally infected, and also to give post-discharge care which may be required 6 months later. Many discharged patients have reported back reinfection around the world, which included post-discharge care, but this aspect has been condoned by government and we ignored it. It's been observed that more than 56% of those discharged after formal treatment did recontract symptoms of COVID-19 in one way or other. Testing speed has been very non-conducive, extremely unsatisfactory, which means no plan can be charted out at present state. Requirement of testing plan, inoculation plan, treatment plan, post-discharge care plans are not available, as must be affected professionally, which missing details clearly indicate that we are a sleeping inefficient nation. Real state of future of COVID-19 Bharat India cannot be correctly either forecast or predicted analytically in absence of such plans or schedules. In this connection, I sent mails to government long time back, but there has been no response only. I don't think government is very responsible in this regard. No change or accelerating program is visible. No projection of any program is available. In fact, testing speed has been still very, very outstandingly unsatisfactory, whereas the government will always try to reflect least number of positive cases by manipulating their data. No reported indications seem to be on part of government to an extent. Testing on the whole population is concerned, and in case of no right, reliable data, no provisions can be reflected. Government doesn't take any responsibility for testing of common citizen. It is assumed to be responsible for citizen to have test himself and digest all expenses on that. If symptomized, you go and test, and distance, it's the government has distance from you towards this fulfillment of responsibility. Tests conducted so far till last day, this 18 January 2021, 18 crore 78 lakhs. Tests conducted on 18 January, 7 lakhs 9,000 something. Total corona infection till yesterday, 18 January 2021, that is 1 crore 5 lakh 81,000 something. Positive infected cases declared on 18 January 2021, 10,064. It's manipulation, and that's the update till yesterday, 18 January 2021 is 1,52,000 something. Population tested is 14.446% only since March 2020. Remaining population without test is 85.554%. Time required for whole population testing is 13-14 days and remaining population is 11-24 days. 13-14 to 11-24 required days admissible whether public has to accept it or public has to reject it. Public has to consider this point very seriously in national interest, but public has been absolutely silent with no word to speak against government. Reason being well understood is why government is not improving its bad performance. There is no clear answer. Government doesn't respond and shall not respond to all at all just to protect its own skin. Government doesn't intend to speak anything in this regard. Government thinks that maintaining silence is best response. One silent defeats hundreds of speakers. Government has actually ignored poor, lower class society members from testing. Why government sleeping? No answer. Public too sleeping? No answer. Unknown worryless state of public? No seriousness seen. Explosion must happen. Government does not look anxious to test all citizens. Testing speed is too low. Government has no responsibility towards citizens for health. Why should people of Bharat India suffer for none of their mistakes? Only sufferers are poor people in society who cannot afford treatment. Shall we allow such unbecoming state of lack of public COVID-19 testing? Why are suffering people not raising their voices? Have people become voiceless? People of Bharat India are not living as slaves, but have become virtual slaves under current regime. Why has government left its responsibility onto people, onto their own care? What for funds have been collected from all walks of life? It seems that all people shall not be tested because till now no such policy seems to exist and no addition is as such because of in non-existing policy there can be no additions. Really speaking, there exists no government policy towards public handling of COVID-19 strain plus. Have test yourself and do everything yourself. Whatever is required, you have to do self-testing or treatment or isolation or hospital expenses or vaccination or whatever. You have to spend money for complete expenses. I don't want to repeat. It's very really tragic state that you have to do all yourself. So keep preserve many lakhs of rupees for one person if you have to join hospital. And if you are many members, then you have to keep accordingly that amount, which is quite magnanimous, quite you can say in lakhs for each person. It's really very say our guards are not doing anything. So ultimate conclusion is that you test yourself, treat yourself, vaccine yourself, isolate yourself, oxygen yourself, ventilate yourself. Self means on patient's expenses. Only government expects credit, and you have to tolerate all this. I'm not going to talk of details in this, but what I'm saying here is that this is still same. All words which I used before are still valid. Sleeping society, sleeping government, inefficient people, sleeping people, careless people, ignorant people, and drastic failure. And even vaccination is not that to that level it should be. So what you should do? I know answer seriousness is a failure here, and you can see this data. So this clearly says if you want to finish text vaccination in 91 days, you have to do 1.43 crores people per day, and testing should also finish in 91 days, so you need 1.22 crores people per day. This is advice from this analysis. I know nobody is going to bother about this. You bother, you don't bother, that's not my concern. My concern is to open your eyes and open your minds, and if you can do that, fine. If you cannot do that, you want to just break your heads. Nobody can stop those people who commit suicide. So indirectly you are going to commit suicide. आपको आत्महत्या करनी है तो कीजिए, कोई आपको रोक नहीं सकता है. कोविड से मरना है तो मरिए, कोई रोक नहीं सकता है. लेकिन जीवन आपका है, आपके परिवार का है, जिंदगी आपकी है, पैसा आपका है, आपको कोई चिंता नहीं है तो ना सही, लेकिन आप जिनके साथ रहते हैं उनसे पूछ के देखिए वो क्या कहते हैं. अगर आपको अपनी चिंता नहीं है तो उनकी चिंता तो होनी चाहिए, वो भी आपको नहीं है. एक बात है यहाँ पर आती है सामने. आपको क्या करना है क्या नहीं करना है आपको समझना होगा. बहानेबाजी नहीं चलेगी सरकार की. सरकार बहुत ऊटपटांग बातें करती है, हमने ये कर दिया, हमने वो कर दिया, लेकिन सच तो है कि ये एनालिसिस जो बोल रहा है कि उन्होंने कुछ नहीं किया और खाली स्टेटमेंट दे दो, बात खत्म. स्टेटमेंट दे दो, चलते रहो, अपने आप पब्लिक संभाल लेगी अपने आप को, और पब्लिक को संभालना है तो पब्लिक तो खैर जो करेगी करेगी, उसका मैं जवाब नहीं दे सकता। क्योंकि जब आपने 325 दिन में भी इतने टेस्ट नहीं किए, 19 करोड़ भी आपसे नहीं हुए 325 दिन में, तो मैं बिल्कुल आशा नहीं रखता सरकार से कि सरकार क्या करेगी इसमें। आई एम नॉट गोइंग टू एक्सपेक्ट एनीथिंग गवर्नमेंट डू समथिंग पॉजिटिव ऑन दिस अकाउंट, बिकॉज इन 325 days only 19 crore tests have not been completed. So what do you expect 130 crore people will be tested? You think vaccination will be applicable to every month? Shall you be able to provide vaccination to all citizens 130 crore? I think that is complete far dream, distant dream. You can't say it will be done. एंड यू कैनॉट वेट फॉर 11-24 days फॉर, आप 11 से 24 दिन तक इंतजार नहीं कर सकते कि आपका ये हो है वो हो। इसके साथ ही आपको सोचना होगा कि आपको क्या करना है। अगर आप नहीं सोच सकते हैं, ये आपकी गलती है। आप सरकार का मुंह देखना बंद कर दीजिए और अपने को संभाल लीजिए। अगर आप संभाल सकते हैं तो यू टेक योर ओन केयर। इफ यू हैव मनी और डू व्हाटएवर यू डू, यू टेक योर केयर ऑफ पीपल, योर मेंबर्स, फैमिली मेंबर्स, वाइफ, ऑल दैट। If you cannot do that, then you wait for risk, and that's it. There's nothing, no one is coming to help you in this case, so you have to help yourself. And if you have to help yourself, means you start helping immediately. Otherwise, you know what shall happen. It shall be very drastic, very drastic. You can say failure everywhere. जब बुरा समय आता है, कह के नहीं आता है। जब बुरा समय आता है, कह के नहीं आता है। जब खराब समय आता है, घंटी बजा के नहीं आता है। वो आ भी जाता है और आपको पता भी नहीं लगता। आ भी जाता है, आपको पता नहीं लगता, और आप देखते रह जाते हैं कि यह क्या हो गया, और उस समय तक कोई सोल्यूशन नहीं होता आपके पास, जब बहुत देर हो चुकी होती। इसलिए समय पे संभल जाएंगे तो अच्छे रहेंगे। वैक्सीनेशन लगवा सकते हैं तो लगवा लीजिए, लेकिन अभी आपको मिलने वाला ही नहीं है, क्योंकि इतनी करोड़ों की आबादी में, अरबों की आबादी में ये लाखों वैक्सीन का क्या मतलब है। अगर लाखों लोग वैक्सीन लेके बच जाएंगे तो अच्छी बात है, लेकिन ऐसा दिखता नहीं है। मैं इस वीडियो को लंबा नहीं करना चाहता, क्योंकि अब मन नहीं करता बात करने का इसके बारे में, क्योंकि हालत बिगड़ती जा रही है। हालत बिगड़ती जा रही है, और ये जो डाटा बता रहा है कि कुछ और कह रहा है अपनी कहानी। कहते हैं ना, कोरा कागज नहीं है ये डाटा। दिस इज नॉट क्लियर पेज, सो मच इज रिटन ऑन दिस। मेरा जीवन कोरा कागज, कोरा ही रह गया। शायद ये कोरा ही रह जाता तो अच्छा था, पर यहाँ तो बहुत कुछ लाल पीले में लिखा है, काले में लिखा है। और जब इतना लिखा है तो कोरे कागज का तो मतलब ही नहीं है। डरावना कागज बन चुका है ये, जो हम सबको डरा रहा है। और ये जो डराने की बात आती है, लेकिन हम डरने वाले तो नहीं हैं। हमारे देश की जनता डरने वाली तो नहीं है। ये ग्राफिक्स कुछ भी कह लें, ये टेबल कुछ भी कह ले, और ये रिक्वायरमेंट्स कुछ भी कह लें, लेकिन हम चलेंगे आगे, युद्ध करेंगे कोविड से। और युद्ध कर रहे हैं, सरकार तो नहीं कर रही है, पब्लिक को करना पड़ेगा। पब्लिक भी नहीं कर रही है, जहाँ तक मैं समझता हूँ। पब्लिक भी ढीली ढाली पड़ चुकी है, जो कि हमारे लिए अच्छा नहीं है। अब इसी बात को कह के मैं ज़्यादा आज नहीं बोलना चाहता, क्योंकि कुछ है ही नहीं बोलने के लिए। और मैं यही कहूँगा, ज़िंदगी आपकी है, लाइफ आपकी है, परिवार आपका है, देश आपका है, मेंबर्स आपके हैं। अगर आपको संभालना है तो संभाल लीजिए। इंजेक्शन कब लगेगा कब नहीं लगेगा उसको भूल जाइए। कम से कम टेस्ट तो करा लीजिए, पता तो लगे कि आपको कोविड हुआ है या नहीं हुआ है। अगर हुआ है तो आप संभल तो सकते हैं। अपने दूसरे मेंबर्स के लिए, अपने दूसरे सदस्यों के लिए इतना तो आप कर ही सकते हैं। और अगर आप फिर भी चाहते हैं हमें क्या लेना देना है, तो भाई मैं कोई आपका दुश्मन तो हूँ नहीं, और आपकी ज़िंदगी आपके लिए, संभालना आपको है, नहीं संभालना तो आपको है। मैं इससे ज़्यादा क्या कहूँगा। इसी बात को क्या कि अब मैं आशा करता हूँ कि आप लोग कुछ करेंगे, आपका